Parietal cell activity and gastric hormone signaling slow with age. That reduces stomach hydrochloric acid after about 60. Lower acid impairs protein breakdown and the release of nutrients like vitamin B12, iron, and calcium. A higher stomach pH also slows pepsin activation. That leaves nutrients bound within food. Absorption becomes less efficient. Ginger contains gingerols and shogales that influence gastric function. Some compounds can modestly increase gastric motility and secretion. That can change the timing and degree of nutrient breakdown and absorption. Watch for concise explanations of which nutrients are most affected and what current studies say about ginger and digestion. Hook. Fatigue is not always aging, sometimes it's malabsorption. Gastric acid secretion declines with advancing age through loss of parietal cell mass and reduced responsiveness to gastrin. Fatigue is not always aging, sometimes it's malabsorption. Mechanism. Lower acid levels mean less activation of pepsinogen to pepsin and poorer breakdown of protein matrices in food. Cause. Nutrients remain bound in food and are less available for intestinal uptake. Effect. Subtle nutrient shortfalls can accumulate and show up as low energy, muscle weakness, or slower recovery from illness. Parietal cell decline also reduces intrinsic factor output in some people. Mechanism. Fewer parietal cells produce less intrinsic factor and less hydrochloric acid. Cause. Vitamin B12 cannot separate from dietary proteins or bind efficiently for absorption in the ileum. Effect. B12 levels fall and can contribute to fatigue, memory changes, and neuropathic symptoms if left unrecognized. This is not solely a problem of age. Medications and chronic gastric conditions can accelerate it. Iron and mineral absorption are affected in parallel. Mechanism. Gastric acid helps convert ferric iron to the more absorbable ferrous form and solubilizes calcium salts. Cause. Hypochlorhydria reduces iron solubility and limits calcium carbonate dissolution. Effect. Iron deficiency and lower calcium uptake may develop despite adequate intake. A practical example is choosing calcium citrate over calcium carbonate when stomach acid is low, because citrate does not depend on acid for absorption. Ginger illustrates how a botanical can influence these processes. Mechanism. Ginger's active compounds, notably gingerols and shogales, stimulate gastrointestinal sensory pathways and increase gastric motility and secretion in experimental and clinical observations. Cause. Faster gastric emptying and enhanced mixing with digestive enzymes can improve the physical breakdown of meals. Effect. This can help liberate nutrients from food matrices and reduce postprandial fullness, supporting overall digestion without promising a cure for deficiency. Small, practical steps reflect these mechanisms. Mechanism-driven choices include preferring food forms that don't rely on high acid for absorption and using digestive aids that enhance motility. Cause-driven examples are taking calcium as citrate, including vitamin B12, fortified foods, and using culinary ginger in meals or as a warm infusion to support digestion. Effect. These measures can improve nutrient availability and may reduce symptoms like low energy. Discussion with a clinician helps tailor them to individual needs and medication profiles. Explain natural reduction of stomach acid with age. Parietal cells in the stomach lining produce hydrochloric acid through H+/K+ ADPase proton pumps. Aging reduces the number and functional capacity of those parietal cells. Cellular wear and diminished regenerative ability cause fewer active pumps in elderly gastric mucosa. The effect is a lower baseline acid secretion and a smaller reserve when stimulation occurs. Gastrin is a key hormone that signals parietal cells to release acid. With age, gastrin release and the parietal cell response to gastrin often become blunted. Altered signaling and reduced receptor sensitivity are responsible. As a result, meal-stimulated acid secretion declines and the stomach shows a weaker secretory response. Neural input also shapes acid output. The vagus nerve and local enteric reflexes normally enhance secretion during eating. Aging commonly brings reduced vagal tone and slower reflexes. That reduced neural drive contributes to lower peak acid levels after food intake. Consequently, the dynamic range of acid production narrows. structural and mucosal changes further lower acid. The gastric mucosa can thin and show atrophic changes, and age-related chronic inflammation can reduce secretory tissue. These tissue-level losses decrease both acid and, in some cases, intrinsic factor production. The combined effect is sustained hypochlorhydria in many older adults, with less capacity to acidify ingested food and gastric contents. Describe impact on B12, iron, protein digestion. Parietal cell loss and lower gastric acid secretion reduce the stomach's chemical ability to process nutrients. Mechanism: gastric acid and pepsin break protein bonds and free micronutrients that are bound in food matrices. Cause: when acid declines after age 60, that release step becomes incomplete. Effect: the body receives fewer bioavailable nutrients from the same meal. Vitamin B12 absorption depends on two gastric steps. Mechanism: acid and pepsin-free B12 from dietary proteins and parietal cells produce intrinsic factor that binds B12 for later absorption. Cause: reduced acid and fewer functioning parietal cells mean less release of protein-bound B12 and often less intrinsic factor. Effect: people may absorb less B12 from meat, fish, dairy, and fortified foods, even if intake appears adequate. Ginger contains gingerols and showgales that stimulate gastric motility and may increase digestive secretions. Mechanism: faster mixing and modest stimulation of secretion can enhance the mechanical and chemical breakdown of food. Cause: when ginger is taken with a meal, it can improve the release of nutrients from the food matrix. Effect: ginger may modestly support B12 availability from food, but it does not replace intrinsic factor or fully reverse age-related parietal cell loss. Non-heme iron absorption relies on an acidic gastric environment. Mechanism: low pH keeps iron soluble and helps convert ferric iron, Fe3+, to the more absorbable ferrous form, Fe2+. Cause: hypochlorhydria reduces that conversion and allows iron to form insoluble complexes with phytates and other food components. Effect: absorption from plant sources such as legumes, spinach, and fortified cereals can fall, reducing iron bioavailability. Ginger's acidifying and prokinetic actions may help in small ways. Mechanism: promoting gastric mixing and stimulating secretions can increase the contact of iron with absorptive processes in the gut. Cause: adding ginger to meals can therefore modestly improve non-heme iron solubility. Effect: this may support iron uptake from specific meals, but will not change iron content of foods or iron stores by itself. Protein digestion starts in the stomach and continues in the small intestine. Mechanism: gastric acid unfolds protein structures and converts pepsinogen into active pepsin, which cleaves peptide bonds. Cause: when acid secretion drops, proteins remain more folded and pepsin activation is reduced. Effect: larger peptide fragments pass into the small intestine, where pancreatic enzymes must do extra work. Amino acid release can be delayed and less efficient, and some peptides may be subject to bacterial fermentation in the upper gut. Ginger can aid the process through motility and secretion effects. Mechanism: ginger's prokinetic action speeds gastric emptying and coordinates digestive phases, while its stimulation of digestive secretions supports enzymatic activity. Cause: these actions can make protein pieces more accessible to pancreatic proteases. Effect: ginger may ease digestion of tougher foods like red meat and dense proteins, improving downstream breakdown and absorption in older adults. Taken together, lower gastric acid after 60 alters the first, critical step of nutrient liberation. Mechanism: decreased acidity and fewer active parietal cells impede release and chemical conversion of B12 and non-heme iron and blunt pepsin-mediated protein cleavage. Cause: these changes reduce nutrient bioavailability from common foods. Effect: practical responses include focusing on food preparation and combinations that enhance release and solubility, for example, mechanical tenderizing of meats, pairing plant iron with vitamin C-rich foods, and using culinary ginger to support digestion. Ginger is a complementary botanical that may modestly improve meal-level digestion through its motility and secretory effects, but it does not replace the specific gastric functions that decline with age. Connect low acid to bloating, weakness, brain fog. Parietal cell function often decreases with age. Mechanism: fewer and less active parietal cells lower gastric acid secretion. Cause: less acid means pepsinogen conversion to pepsin falls and protein digestion is incomplete. Effect: larger protein fragments enter the small intestine and sit there longer, feeding bacteria and producing gas. Bloating follows from that slowed digestion and increased fermentation. Stomach acid also helps solubilize minerals and freeze vitamin B12 from food. Mechanism: low acidity reduces iron, calcium, magnesium, zinc, and B12 release from meals. Cause: these nutrients become harder for the gut to absorb. Effect: iron and B12 shortages can lead to fatigue and muscle weakness, and to cognitive slowing or brain fog through reduced oxygen delivery and impaired neuronal function. Energy falls when key cofactors and minerals are not available for metabolic reactions. Reduced acid alters the microbial environment too. Mechanism: a less acidic stomach is a weaker barrier to oral and small intestinal bacterial overgrowth. Cause: excess bacteria metabolize carbohydrates and proteins into gases and metabolites, such as short-chain fatty acids and delactate. Effect: people may experience persistent bloating, abdominal discomfort, and cognitive symptoms that some clinicians describe as brain fog when metabolites interfere with normal neurotransmitter balance and induce low-grade inflammation. Ginger offers a botanical example of how digestive support can relate to these pathways. Mechanism: ginger contains bioactive compounds like gingerols and shogales that have been shown to promote gastric motility and reduce nausea. Cause: faster gastric emptying and a carminative effect reduce the time undigested food remains available for problematic bacterial fermentation. Effect: many people report less post-meal bloating, improved meal tolerance, and clearer thinking when digestion is smoother and nutrient flow is more consistent. Ginger may also help indirectly with nutrient handling. Mechanism: by improving motility and reducing gut stasis, ginger can increase the contact of food with digestive enzymes and absorptive surfaces. Cause: more efficient transit and mixing can aid enzymatic breakdown and subsequent absorption of vitamins and minerals. Effect: this can support better energy levels and cognitive performance, especially when low acid has been a limiting factor in nutrient uptake. Use of ginger should be considered adjunctive and individualized. Mechanism: botanical action is supportive but not corrective of underlying hypochlorhydria or nutrient deficiencies. Cause: persistent weakness or brain fog that stems from malabsorption usually requires assessment of iron, B12, and other labs. Effect: addressing those deficiencies directly, while using ginger to ease symptoms like bloating, gives a balanced approach without overstating benefits. Explain digestive motility and enzyme activation. The gut moves food by coordinated muscle contractions. Peristalsis pushes a bolus forward through sequential contraction of circular and longitudinal muscle. Cause: enteric neurons and pacemaker cells called interstitial cells of Cajal generate rhythmic slow waves. Effect: chyme advances and reaches sites where specific enzymes act. Mixing occurs through segmentation and antral grinding. Mechanism: alternating contractions break particles and fold chyme against enzyme-rich secretions. Cause: this increases surface area and re-exposes food to enzyme contact. Effect: digestion efficiency rises because enzymes meet more substrate. Stomach motility controls particle size and emptying rate. Mechanism: strong antral contractions triturate solids while the pylorus permits only small particles through. Cause: pacemaker and vagal modulation set the rhythm and strength of these contractions. Effect: optimal particle size and time delivery to the duodenum allow pancreatic enzymes and bile to work effectively. Acid-driven enzyme activation begins in the stomach. Mechanism: parietal cells secrete hydrochloric acid and lower gastric pH below about 3.0, which triggers pepsinogen to autoactivate into pepsin. Cause: Pepsin then cleaves proteins into peptides and helps denature complex protein structures. Effect: downstream pancreatic proteases encounter partially digested protein, increasing overall protein breakdown and absorption. Pancreatic enzymes arrive as inactive zymogens. Mechanism: enteropeptidase on the duodenal brush border cleaves trypsinogen to form trypsin. Cause: trypsin then activates other zymogens such as chymotrypsinogen and procarboxypeptidases in a cascade. Effect: this cascade produces a full complement of proteases at the right place and pH for efficient protein digestion. Lipid digestion requires both enzymes and motility. Mechanism: bile salts emulsify fats into micelles and pancreatic lipase, with colipase, hydrolyzes triglycerides at the oil-water interface. Cause: strong mixing and proper timing of bile release expose lipid droplets to lipase. Effect: fatty acids and monoglycerides form micelles that the enterocyte brush border can absorb. Ginger provides a botanical example of motility modulation. Mechanism: ginger constituents such as gingerols and showgales interact with sensory ion channels and enteric pathways, and they can influence antral contractions and gastric emptying in studies. Cause: modulation of vagal and serotonergic signaling changes smooth muscle tone and timing of gastric emptying. Effect: improved mixing and controlled transit can increase enzyme contact time and sometimes ease symptoms related to delayed gastric emptying. The link between motility and enzyme activation is tightly tied. Mechanism: acid neutralization by pancreatic bicarbonate is needed for optimal enteropeptidase and pancreatic enzyme function in the duodenum. Cause: if gastric emptying is too fast or too slow, pH and substrate presentation are altered. Effect: enzyme activation, substrate breakdown, and nutrient absorption can all become less efficient when motility and activation are out of sync. Introduce ginger's role in gastric stimulation and motility. Ginger contains pungent compounds called gingerols and showgales that interact with the gut lining and local neurons. These compounds modulate sensory receptors in the stomach and small intestine, and they appear to influence serotonin-mediated signaling in the enteric nervous system. As a result, gastric smooth muscle activity increases and antral contractions become stronger, which promotes more effective mixing of food with digestive secretions. Ginger's biochemical activity can accelerate gastric emptying in people with delayed motility. By enhancing peristaltic waves and coordinating antral pyloric function, it reduces prolonged gastric retention. The effect is improved transit of chyme into the small intestine, which can increase the opportunity for nutrient contact with absorptive surfaces. Common preparations show different practical effects. Fresh grated ginger and strong ginger tea deliver volatile and soluble compounds rapidly to the stomach, producing quicker stimulation. Standardized extracts and encapsulated forms release constituents more slowly and can give a more sustained prokinetic action. Choosing the form alters timing and degree of gastric stimulation and therefore changes how digestion proceeds after a meal. Ginger's motility effects influence nutrient absorption indirectly rather than by raising acid secretion. By shortening gastric residence time and improving mechanical breakdown, it promotes more uniform delivery of partially digested food to the duodenum. This can help nutrients reach sites of absorption more consistently, but it does not substitute for low gastric acid when acid-dependent digestion is required. Clarify supportive versus medical treatment boundaries. Low stomach acid reduces the breakdown of protein-bound nutrients. Mechanism: acid normally frees vitamin B12 from food proteins and activates pepsin for protein digestion. Cause: when acid is low, that liberation is incomplete. Effect: less B12 absorption and higher risk of deficiency symptoms and reduced iron and calcium uptake in some cases. Ginger can help digestion in older adults. Mechanism: ginger stimulates gastric motility and can promote gastric emptying, and it has mild prokinetic and antiemetic actions. Cause: faster gastric transit and reduced nausea may improve appetite and food intake. Effect: better oral intake and reduced dyspepsia, which can support overall nutrition but does not reliably correct biochemical deficiencies caused by low acid. Use ginger as a supportive measure, not as a substitute for diagnosis. Mechanism: botanicals influence symptoms and function rather than replace missing intrinsic factor or correct autoimmune loss of parietal cells. Cause: some causes of hypochlorhydria, such as pernicious anemia or chronic H. pylori infection, require targeted medical therapies. Effect: relying only on ginger can delay necessary tests and treatments like B12 replacement or eradication therapy. Know when medical care is required. Mechanism: autoimmune destruction of parietal cells reduces intrinsic factor and acid production. Cause: that process leads to marked B12 malabsorption and neurological risk. Effect: prompt medical evaluation, laboratory testing, B12, methylmalonic acid, CBC, iron studies, H. pylori testing, and antibody panels when indicated, and clinician-directed treatment are essential. Combine supportive and medical approaches under supervision. Mechanism: ginger and dietary changes address symptoms and meal tolerance. Cause: improved symptoms can make prescribed supplements and dietary strategies more tolerable. Effect: together they can optimize nutritional intake while medical treatments correct underlying pathology. Watch for interactions and limits of botanical use. Mechanism: ginger can affect platelet function and interact with anticoagulants. Cause: when combined with blood thinners or certain prescription drugs, bleeding risk or altered drug effects may increase. Effect: discuss ginger use with a clinician or pharmacist before starting it, especially when on multiple medications. Choose medical treatment when objective deficiency or alarm signs appear. Mechanism: replacement therapy, for example, parenteral or high-dose oral vitamin B12, bypasses the need for gastric acid or intrinsic factor. Cause: this corrects tissue deficiency directly. Effect: symptoms and lab values often improve only with appropriate medical intervention, so botanicals should not replace prescribed therapies. Practical example: an older person with mild post-meal discomfort might use ginger tea and adjust meal composition to support digestion. Mechanism: ginger eases nausea and improves transit. Cause: better eating patterns follow. Effect: nutritional intake may improve, while periodic lab monitoring ensures no occult deficiency is missed. Keep clear roles. Mechanism: supportive therapies relieve symptoms and enhance comfort. Cause: medical therapies diagnose and treat physiologic deficits or disease. Effect: use botanicals to support and rely on medical care to evaluate, monitor, and correct clinically significant deficiencies. Absorption efficiency determines vitality. Gastric acid activates pepsinogen into pepsin and helps liberate vitamin B12 from food proteins. It also maintains non-heme iron in a soluble, more absorbable ferrous form and increases solubility of some calcium salts. Mechanism: parietal cells secrete hydrochloric acid through proton pumps to lower gastric pH and enable these reactions. Cause: after age 60, many people show reduced acid secretion due to lower parietal cell mass and altered regulatory signaling. Effect: the chemical steps that free and solubilize nutrients become less efficient, and less substrate is available for intestinal uptake. Protein digestion and micronutrient release both rely on those early gastric steps. Mechanism: impaired acid reduces pepsin activation and delays protein denaturation. Cause: this leads to incomplete breakdown of protein-bound vitamins and minerals within the stomach. Effect: B12 cleavage from dietary protein is diminished, iron stays in less absorbable forms, and calcium carbonate is less soluble, all of which can reduce nutrient uptake and support for body systems. Ginger provides a practical botanical example of partial compensation without substitution. Mechanism: gingerols and showgales act on the gut to stimulate motility and can promote gastric emptying and sensory modulation. Cause: faster mixing and improved transit increase mechanical breakdown and contact between food and digestive enzymes. Effect: this can ease symptoms and modestly aid digestion, but it does not replace acid-dependent chemical reactions needed for full nutrient liberation and absorption. Maintaining efficient absorption becomes central to sustaining physical and cognitive function. Mechanism: Adequate nutrient bioavailability supports muscle protein synthesis, erythropoiesis, bone remodeling, and neurotransmitter production. Cause: when gastric processing falters, downstream tissues receive fewer usable building blocks. Effect: energy, strength, and resilience can decline if absorption is chronically impaired. Therefore, attention to meal composition, food preparation, and supportive measures that improve digestive efficiency matters. Absorption efficiency determines vitality. Parietal cell decline and lower proton pump activity reduce gastric acid secretion. This commonly happens after age 60. Lower acid can impair release and absorption of vitamin B12, iron, and calcium, and can slow protein digestion. Ginger contains gingerols and showgales that stimulate stomach motility and may modestly influence secretions. Consuming ginger as food, tea, or a supplement is the usual route. Some people report easier digestion and slightly better nutrient breakdown, but evidence is limited and variable. Mechanism: reduced acid can be subtle and overlap with other conditions. Cause: age-related changes and medications can both contribute. Effect: targeted testing and professional review can clarify whether absorption is affected. If you are over 60 or care for someone who is, this information may matter. Consider discussing symptoms and testing with a healthcare professional before changing treatments or supplements. If you found this useful, like and subscribe for more clear, practical explanations. In upcoming videos, we will explore dietary strategies, testing options, and the evidence behind common botanicals.